Did you know that according to Hemophilia Federation of America, about 400 babies are born with hemophilia each year in the U.S.? With this information not being common knowledge, I think everyone should learn about hemophilia and pedigree to become more aware. So for the next few moments, I would like to explain what hemophilia and pedigree is, the signs and symptoms of hemophilia, and the possible treatments. First, what is hemophilia and pedigree? Pedigree is a diagram that shows biological relationships between organisms and their ancestors. It is used to look at transmission of genetic disorders. Hemophilia is an inherited bleeding disorder. The hemophilia gene is inherited through the X chromosome. Per the picture, if the mother is a carrier for the hemophilia gene and the father does not have hemophilia, then they should expect to have one son without hemophilia, one son with hemophilia, one daughter who is a carrier of the hemophilia gene, and another daughter who doesn't have hemophilia, nor is a carrier of the gene. People with hemophilia lack proteins called clotting factors that help stop bleeding. This can cause abnormal and uncontrollable bleeding, such as nonstop bleeding after a surgery. What are the signs and symptoms? The signs and symptoms may vary depending on the severity of how low the clotting levels are. If the levels are only slightly reduced, there might only be excessive bleeding after trauma or surgeries. If your levels are severely reduced, you might just bleed for no reason. You might also find many large bruises, tightness in joints, blood in bodily functions, nosebleeds, and in children, unexplained irritability. You should seek medical attention if you have an injury that won't stop bleeding, and if your joints are hot to the touch and hurt to bend. What is the treatment for hemophilia? The best way to treat hemophilia is to replace the missing blood clotting proteins so that the blood can clot. It is typically done by injecting clotting factor concentrates into the vein. Now, it is possible for some people to be able to give their own clotting factor injections at home. This would lead to a quicker treatment and less serious bleeding. There's also a medication called Amisar that can be administered in a pill or liquid form or through a vein. It helps the blood clots from breaking down. Most often this is given after an oral surgery to block the substance in spit that breaks down blood clots. Another medication is Hemophilia, which is injected under the skin, and instead of replacing clotting factors altogether, it only replaces the function of what they do. These are only a few of the treatment options, and currently there is no cure. To conclude my presentation, hemophilia is an inherited blood disorder that can, in most cases, be predicted through a pedigree. There are some signs and symptoms to look out for, and even though there is no cure, there are still intravenous or oral treatment options. Thank you.